Yo, yo, everybody. Today I am talking about an evaluation I just did for a severely herniated disc. Okay, so I just did an evaluation of a patient that had, I'm looking at the radiology report of the MRI before I take the patient back, and I'm sitting there and I'm going, whoa, like L3-4, L3-4, L4-5, central protrusions abutting the thecal sac. Okay, well, we see that a lot. And then I saw at L5S1 a extrusion. Now, anytime I find that the radiologists start throwing the word around extrusion, that they're talking about a severely herniated disc. Okay, and I so I'm looking at this MRI and I'm thinking I'm about to get into a sciatica eval, like straight up sciatica, not SI joint, straight up sciatica, right? And so the patient starts talking and low back pain. I'm like, well, I generally find that low back pain is not sciatica. Um, I have a clinic where I call it the failed everything clinic for, especially for low back pain. And I open up SI joints all day long, rotate their sacrum back, and the shearing pain in their back stops, regardless of what I see on the MRI. So I generally find that's not the case in my patients. But it came down his leg. So I asked, does it go into your foot? Because SI joint goes actually to the very top of the foot, the sides I've found, and then it's documented that it comes down the side of the leg into the calf, right? Lateral calf. I've actually seen it in the anterior and medial. I see all kinds of crazy referred pain patterns. Okay, now, so this patient, had, tried all kinds of things and could not find a solution. And they're talking about surgery, that kind of thing, right? For his herniated disc. But I always clear the SI joint, okay, before I even talk about it being something different. Okay. So this patient went like this. So I checked his myotomes, I checked L5, L4, S1, L3. The whole thing, I checked his myotomes just to make sure he belonged here. But while I check his quad, I always just flip a patient's toe back like that to do a slump test, okay? And he had nerve tension, right? So I'm like, okay, well, that's a positive slump test, but I've said this before, that the slump test, you can misdiagnose somebody on a slump test. Everybody thinks that if the person has pain in their back or their leg, well, they do this, then they have a herniated disc in their back. Well, I just saw that a herniated disc is back in this. But my question was, where is it hurting you in your back when you do this? And he pointed to the side, to his sacroiliac joint. And I said, okay, because so many times in the past, the person has a positive slump test, right? And they say it hurts in their back, right? But then I open up their SI joint and I wrote a paper called Root Cause of SI Joint Dysfunction. It's on my website, weltonmethods.com. It statistically has made medical history and readership in medicine. And so I open up his SI joint. I pull on his leg. I open up the outflare, which I propose in that paper is causing SI joint dysfunction. And he is able to go up further like that, more range of motion without pain, right? And then he had such a stiff pelvis that I put a ball between his knees while he was doing a slump test, okay? And that helped too. He's able to get his leg up a little higher and that helped the pain to back and to some extent. But then what I did is I got the upslip. You got to get the upslip first, okay? And then what I did is I grabbed, I sat right here, and I went like this, and I hooked my arm around his ASIS like that, in sitting like this. Okay, so I hooked like that, and I opened his ASIS. Okay, it takes a lot of force actually with the ball squeeze, And when I pulled hard enough, we were able to get that SI joint open, okay? And his leg went out like that, and his back pain was gone. So to be clear, this patient pointed here on a positive slump test, okay? Not here, okay? Here. So it's you can misdiagnose patients just by just saying, oh well, they have pain in their back when they lift their leg up, it's a herniated disc. Well, start realigning SI joints the way that I do it, and I wrote in my paper, and I teach in my school group. Click on the free school group below. Join my VIP group. I teach this, okay? And I started to notice that slump tests go away, okay? And then I do the rehab for SI joint, and then the person's pain goes away. Well, what's happening? So that SI joint is a very jagged joint, right? So when that goes out of alignment, if you take the innominate and go like that to it, it shears the actual joint. And then the person has pain when you go like that to them, okay? It's mechanical, okay? So never, ever, 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 ever just rely on imaging or anybody else's diagnosis, okay? Especially when it comes from pain from the lower thoracic into the foot, okay? Always open the SI joint and you have to hold it open in some cases, okay? Probably half the chronic pain case I see, I have to hold it open because it's so stuck. It's been out for like 10, 20 years. Patients have been, they have the I failed everything story. And anyways, so that is actually what was causing this guy's pain. Now, like I said, I was reading an MRI before I walked back. It said extrusion of L5S1, herniated disc on the spinal nerve. So I'm thinking this is a straight up nerve sciatica case. Guy was in his 30s, typical age, right? He had a herniated disc. Nobody was arguing that. But his pain was actually coming from his SI joint. Okay. So to be clear, a slump test is not positive if the person's pointing to their SI joint, and then you clear the SI joint and redo the slump test. Okay. Is the quickest way to misdiagnose somebody. If you have any questions, let me know. Also, sign up for my school group. My VIP group. I linked it under this video. My VIP school group, and it's a free group. And I go much more in depth than I do here. I teach clinical teachings on there, and also I have an advanced membership where I work with people one-on-one. And I have a hybrid clinical mentorship where I teach people how a totally different type of cash-based practice. I teach you in working 3 days a week, you can make 7 figures in this model, but you need the clinical skills to do it, which is why I teach the clinical skills, okay? So many people aren't confident, and they're like, well, I can't do that. I don't feel confident as a clinician. Well, that's my goal, is to make people confident at what they at this job. Now, a lot of people say I have imposter syndrome, I have this, that, the other thing. But the brain is rational. Your left brain over here is a very rational brain, okay? Your ego brain. And it doesn't just believe things, okay? Like if you just say, I'm a good physical therapist, it doesn't believe it, okay? But what if you start out diagnosing everybody in your area? What if you are getting patients better that nobody knows what's wrong with them, right? Now, all of a sudden, you have confidence. So when I teach people this, like there's a physical therapist from Luxembourg. His name is Jeffrey John. I repost some of his stuff here. And he advertises on his website that he gets 90% of his patients better, out of pain immediately, and 99% of his patients better, he told me, using my methods. He went from 75% to 99%. You can ask him, okay? And he's part of this group. Click it below. Jeffrey John is his name. Phenomenal physical therapist, okay? One of the best in the world. And he cut and pasted. He doesn't have confidence issues, okay? But he was at 75% success rates. And if you look up on ChatGPT, it's 50 to 75% for physical therapists. But like that's not in the I've failed everything clinic. That's in like ankle sprains and stuff, which is not I mean, they basically get better on their own, you know? So, anyways, I think it's much lower than that. In fact, I traveled this country and I taught, and I talked to COO of a company who told me it's about 25% with certain patient populations. So, no bueno. But my goal is to change that. Okay. So, join my free school group below. Okay. And I teach you how I have what I call the I failed everything clinic, and I get exceptional results. I generally do not worry about my patients getting better. Every once in a while, somebody gives me a run for my money. But other than that, like, I'm not too worried about it. You know, I'm not too worried about it. This isn't like overly complex to me. Even complex patients are not overly complex. Now, can I fix everything? No. Um, if you have Caudy-Quine syndrome, I won't touch it. If you have disc indenting your spinal cord, especially in the cervical region and thoracic, you know, not touching it. If you have arthritis, you know, severe arthritis, I can relieve the pain, but I can't make that go away, you know? Now, maybe if we can invent some advanced technology, we could do that, but we can't do that. No. So anyways, you know, this whole thing with confidence is easily fixable. The more I talk to people, the more I realize that confidence is a massive issue, okay? And it doesn't need to be, okay? And the reason why is because I take these students, there's another student, Tatiana Shaket, she's one of my business students. I'm teaching her how to open and run one of these highly profitable. You can work 3 days a week and make 7 figures in this, okay? And your overhead's like 35%, okay? Do the math, okay? And I'm teaching her how to open and run one of these clinics. And she took my courses years ago. She's in Aurora, Colorado. She took my courses years ago. And I asked her when I started coaching her in business, and I asked her, and clinical, but I asked her, I said, Tatiana, what percent of your patients get better? And she said, she thought for a second, and she goes, all of them. And I'm like, all of them. And she's like, yeah. And she does my methods. I just told you, this guy in Luxembourg says 99%. He put it in writing and put it out on social media. 99% of his patients get better. So these people don't have confidence problems. You know, these people know that they have patients coming from everywhere to see them because they have skills nobody else has. Now, when it comes to this hybrid, my hybrid cash-based business model, the reason why we charge a premium is because we're excellent at what we do, you know? And when you're excellent at what you do, you can charge a premium, and patients are desperate to find somebody that's excellent at what they do, okay? Who actually understands what's wrong with them, not sign up for a 1-year program or whatever, like my last patient told me, you know, and she didn't get better, and then do this and that and experimental trials and this, all this craziness when it wasn't even, they weren't even working on the source of the pain, which I've found to be a few issues I see in here constantly that are misdiagnosed. So having said that, okay, having said that, when it comes to the slump test, don't trust it. Okay, I like to test. I had a herniated disc one time. Okay, and I couldn't extend my leg out all the way. Okay, but in a lot of these patients, I open up their SI joints and the slump test becomes negative. Okay, and it was actually they were pointing to this, the side here, their SI joint. They weren't pointing to the center of their back. You have to look, turn around and look into where they're pointing, and open up that SI joint anyways. Okay, click the link below. I'm teaching it in there for free. My free school group. Click the link below. I will see you in there. And I'm teaching people what I do to get exceptional results when nobody else knows what's wrong with these people. Okay? I've been doing this for years. This is not overly complex to me. Okay? I published papers that statistically made medical history. Okay? Go to whatever social media you're at, go to the top. It should be pinned right there, the analytics from the journal. Multiple times what even the biggest medical journals, not orthopedics, medical journals in the world, according to AI, get. The AI says these are some of the most viral papers in all of medicine right now. Okay? And 3 to 5 years post-publication, they're getting 13,000 views annually, almost 12,000 on my SI paper and my other ones too. These are off the charts. There's a reason why that happened. Okay? Anyways, that's that. Peace. Love you all.